Cardiac emergencies are among the most critical and time-sensitive situations paramedics face. Proper assessment, prompt intervention, and accurate medication administration can save lives. This article provides an overview of key cardiac emergencies, including acute myocardial infarction, AMI, ventricular tachycardia, VT, bradycardia, and palpitations, along with the treatment and medications paramedics can provide. Acute myocardial infarction, AMI, overview. Acute myocardial infarction occurs when blood flow to the heart muscle is obstructed, typically due to a thrombus in a coronary artery. This results in ischemia and necrosis of the heart tissue. Signs and symptoms: severe chest pain or discomfort, often described as crushing or squeezing. Pain radiating to the arm, neck, jaw, or back. Shortness of breath, diaphoresis, nausea, and dizziness. Treatment and medications: oxygen therapy. Administer oxygen if the patient is hypoxic. SPO2, 94%. Aspirin. Administer 160 to 325 milligrams to inhibit platelet aggregation. Ensure no contraindications. Nitroglycerin. Provide 0.6 milligrams sublingually every 5 minutes up to 3 doses to reduce myocardial oxygen demand and relieve chest pain if systolic BP is 100 mmHg. Pain management: morphine, 2 to 4 milligrams IV, may be used for severe chest pain unresponsive to nitroglycerin as per protocol. Rapid transport. Expedite transport to a facility with percutaneous coronary intervention, PCI, capabilities. Ventricular tachycardia, VT. Overview. Ventricular tachycardia is a rapid heart rhythm originating in the ventricles, often associated with underlying cardiac conditions. Sustained VT can lead to hemodynamic instability and cardiac arrest. Signs and symptoms: palpitations and rapid pulse if conscious. Dizziness, hypotension, or syncope. Unresponsiveness and pulselessness in severe cases. Treatment and medications: stable VT amiodarone, 150 milligrams IV over 10 minutes, followed by an infusion if necessary. Consider synchronized cardioversion if medications are ineffective. Unstable VT with pulse, immediate synchronized cardioversion. Follow up with antiarrhythmic medication, for example amiodarone. Pulseless VT initiates CPR and defibrillation as per ACLS guidelines. Administer epinephrine 1 milligram IV or IO every 5 minutes. Consider amiodarone 300 milligrams IV or IO for refractory cases. Bradycardia overview. Bradycardia is characterized by a heart rate 60 BPM. While it can be asymptomatic, severe bradycardia may cause hemodynamic compromise. Signs and symptoms: dizziness or lightheadedness, hypotension, syncope or near syncope, fatigue or weakness. Treatment and medications: assess stability. If asymptomatic, monitor and observe. If symptomatic, proceed with interventions. Atropine, 0.5 milligrams IV every 5 minutes, up to 3 milligrams total, to increase heart rate. Transcutaneous pacing, initiate if atropine is ineffective or contraindicated. Epinephrine or dopamine infusion: epinephrine 2, 10 mag/min. Dopamine 2, 20 mcg/kg/min. Rapid transport. Ensure timely transport to a facility capable of advanced cardiac care. Palpitations. Overview. Palpitations are the sensation of an irregular or rapid heartbeat, often caused by arrhythmias, anxiety, or structural heart conditions. While usually benign, they can signal a serious underlying issue. Signs and symptoms: awareness of heart pounding, fluttering, or skipping beats. Associated symptoms: chest discomfort, dizziness, or shortness of breath. Treatment and medications: identify the cause, obtain a detailed history, and monitor the heart rhythm, for example ECG. Check for reversible factors such as electrolyte imbalances or stimulant use. Stable patients: encourage relaxation techniques for anxiety-induced palpitations. Administer beta blockers, for example metoprolol, for symptomatic tachycardia if indicated. Unstable patients: treat underlying arrhythmias, e.g. Vermont or atrial fibrillation. Synchronized cardioversion may be required for hemodynamically significant cases. General approach for paramedics: primary assessment. Ensure airway, breathing, and circulation, ABCs. Identify life-threatening conditions immediately. Secondary assessment: obtain sample history, signs, symptoms, allergies, medications, past medical history, last oral intake, events leading to the condition. Perform a focused physical exam and obtain a 12-lead ECG. Communication and transport: notify the receiving facility of the patient's status and treatments initiated. Continuously monitor the patient en route. By understanding these cardiac emergencies and the appropriate interventions, paramedics can provide life-saving care in the field, ensuring the best possible outcomes for their patients.